welcome to my channel. In the last lecture we started off with cardiovascular system and we discussed about the heart failure. A quick recap before we go into the details of the next drug. We discussed that for treatment purposes heart failure is divided into two main headings. One is acute failure and other is chronic failure. Under acute failure we have two main pharmacotherapeutic objectives. One thing, we have to decrease the congestion, and second objective is we have to increase the contractility. In order to decrease the congestion, we have drugs like diuretics, in which there are two types of diuretics. One is loop diuretics and thiazide diuretics. Out of both of them, loop diuretics are the drug of choice. For contractility, we want the contraction of the heart to increase. For that, we have inotropic drugs. Under inotropics, we have dopamine, dobutamine, and the drug which was newly approved for heart failure was inodilators, and under this category we have amilimon and milimon. Today, the drug which we have to discuss is digoxin. I want to dedicate this full lecture on digoxin because it is important for both theory as well as for the NEET exam. So let's discuss digoxin. First important thing under digoxin is that it is obtained from the natural resources, that is digitalis purpura. The question asked with respect to digitalis purpura is the image based question, which is quite frequently asked in your AIMS exams also. A photograph of a plant is shown and that is digitalis purpura, and the options are given that identify the above given image. So this is very important that digoxin is obtained from a natural resource, that is digitalis purpura. There are three main compounds under digoxin, that is digitoxin, digoxin and vervain. These are the three sources or the compounds which are available in form of digoxin. The most commonly used is digoxin, which we will be discussing now. Now first thing first is the mechanism of digoxin. Why do we use digoxin in heart failure? For that, first we make a cardiac or myocardial cell. This is the myocardial cell. There is an enzyme present here. This is sodium potassium ATPase enzyme. Here also we have sodium potassium ATPase enzyme. Supposedly this is the normal cycle and this is the myocardial cell on which digoxin is acting. First we will see the normal functioning of the cell. What happens? Normally 3 sodium go outside the cell and 2 potassium come inside the cell. When this enzyme sodium potassium ATPase is working under normal conditions, 3 sodium is going out and 2 potassium is coming inside. That means sodium is deficient in the cell. This you have to remember, that sodium is deficient in the myocardial cell. When this happens, there is one more exchanger present, that is sodium calcium exchanger. Sodium calcium exchanger. Now we know that sodium is deficient in cell. So from outside, this exchanger will bring sodium inside and calcium outside. This exchanger will bring sodium inside and calcium outside. Why? Because sodium is deficient in the cell. This is the normal heart or the normal functioning of the myocardial cells. Now what is the site of action of digoxin? Digoxin acts here. at sodium potassium ATPase pump. It inhibits the sodium potassium ATPase pump. With this, there will be no sodium going out and no potassium coming in. That means there is collection of sodium inside the cell, because when there is inhibition of the sodium potassium ATPase pump, there is accumulation of sodium inside the cell. Now when the sodium is already present inside the cell, this exchanger will also not work. This sodium and calcium exchanger will also not work, and there will be no sodium coming inside, so there will be too much of calcium inside. So now there is calcium inside the cell which is not going out because there is inhibition of sodium calcium exchanger also. Now this accumulation of calcium inside the cell, they go inside the circle. Sodium endoplasmic reticulum, all the calcium gets collected and they go inside the circa, that is sarcoplasmic endoplasmic reticulum. Calcium goes inside. Now whenever there is a wave of systole, this all calcium will come out of the cell and they will cause myocardial contraction. Now I will repeat myself. The site of action for digoxin is sodium potassium ATPase enzyme. Whenever this enzyme is inhibited, there is too much of sodium inside the cell. When the sodium is inside the cell, it further inhibits the sodium calcium exchanger, because now there will be no calcium going out or sodium coming in. Now when calcium is not going out, it will be too much in the cell. This calcium again gets collected and goes into the sarcoplasmic endoplasmic reticulum. Whenever there is wave of systole, this calcium comes out of the sarcoplasmic endoplasmic reticulum and further causes myocardial contraction. So this is the first mechanism of digoxin. The second mechanism is related to the use in atrial flutter and fibrillation. Apart from heart failure, digoxin is used in atrial flutter and atrial fibrillation. Suppose this is the heart. Here is the SA node. Here is the AB node. Now the contractility was increased when digoxin was given in heart failure. When we have to use digoxin in case of atrial flutter and fibrillation, its vagomimetic effects come into play. Vagomimetic effect. Now what happens? Vagus is innervating this SA node. Vagus is an inhibitory nerve. It inhibits the conduction of SA node to AB node. Whenever there is atrial flutter and fibrillation, there is too much of impulses going from SA node to AB node. When digoxin is given, it increases the vagus effect on SA node. Increases the vagus effect of SA node, and thus it inhibits the AB conduction. So when the normal rate from the SA node to AB node is getting transmitted, the ventricular rate is also controlled and atrial rate is also controlled. But this use is only in atrial fibrillation. There is a catch to this, that when digoxin is given in atrial flutter, the first process is that atrial flutter gets converted into atrial fibrillation. If digoxin is given in atrial fibrillation, it is normally working inhibiting the SN node to AB node conduction. But when given in atrial flutter, it first get converted into atrial fibrillation and then it comes to sinus rhythm. So there is a pathway between the atrial flutter and sinus rhythm. It gets converted into atrial fibrillation first and then into sinus rhythm. So two mechanisms of action of digoxin. One, it increases the force of contraction, increased use in heart failure. Second use is that it has vagomimetic action, and that use is utilized in atrial flutter and fibrillation. Now we will discuss about the pharmacokinetics of digoxin. Under pharmacokinetics, first point is it is the only inotropic drug which can be given orally. That means it has good oral absorption. Only drug which is given orally. The second important point under pharmacokinetic activity is that it has poor protein binding, which is around 25%. Only 25% of plasma protein binding is seen in digoxin. Third point is that half-life of digoxin is around 40 hours. There are very few drugs in pharmacology for which you have to remember the half-life, and digoxin is one of them. Digoxin has half-life of 40 hours. Next is the elimination process. Under elimination, digoxin is eliminated through renal route. There is renal elimination. So, important thing to learn here is that there is dose adjustment required in renal failure patients. Dose adjustment in renal failure patients. So these are the pharmacokinetic properties. One, it is good oral absorption is there. Second, there is poor protein binding. Half-life of the drug is very long, that is 40 hours. And last is the elimination, that is through the renal route, and for which there is dose adjustment required in the renal failure. Now, if we discuss the side effects of digoxin, side effects. First is the most common earliest side effect. There are two things here, most common also, earliest. Most common and earliest side effect is nausea and vomiting. Nausea and vomiting. Second point is most common side effect is also nausea and vomiting. So the earliest symptom from digoxin toxicity is also nausea and vomiting, and most common side effect is also nausea and vomiting. Third thing, what is the most common cardiac side effect? Cardiac side effect, if it is asked, it is arrhythmias. It is arrhythmias. And under this, if you want to know that which type of arrhythmia is seen, it is non-ventricular tachyarrhythmia. The type of arrhythmia, which is the cardiac side effect of digoxin, it is non-ventricular tachyarrhythmia, and quite frequently it is asked that what is the drug of choice of digitalis-induced arrhythmia? Digitalis or digoxin-induced arrhythmia. The drug of choice is lignocaine. Treatment of digitalis induced arrhythmia is lidocaine, and the cardiac side effect is non-ventricular tachyarrhythmias. So these are the few side effects which is related to digoxin. Now comes the toxicity of digoxin. Target therapeutic concentration of digoxin is 1 nanogram per ml. This is the target therapeutic concentration which you have to achieve. Toxic doses, the toxic concentration is more than 2 nanogram per ml. These are the two therapeutic concentrations which you have to remember with respect to digoxin. That is, the target concentration is 1 nanogram and the toxic concentration is more than 2 nanogram per ml. Now there are two methods of treatment. One is for the mild toxicity and other is for severe toxicity. When there is mild toxicity, the treatment of choice is potassium. Treatment of choice is potassium. Why? Because it inhibits the binding of digoxin to sodium potassium ATPase. Potassium is present extracellularly outside the cardiac cell where digoxin is also present. So both of them, they compete for the sodium potassium ATPase enzyme. And when potassium is given, it will inhibit the binding of digoxin to sodium potassium ATPase enzyme. But when there is severe toxicity, potassium is contraindicated. Potassium is contraindicated, and for this we will give Digoxin. It is an antibody which binds to the digoxin molecule. It is Digoxin, which is given in severe type of toxicity. Now comes the contraindications of digoxin. For that you have a mnemonic. Contraindications. Mnemonic is contraindicated in weak heart. In weak heart. C for carditis. I is for increased potassium levels. WPW syndrome. WPW syndrome. E is for elderly patient.